guys, welcome back to Medical Coding with Blue. Today's episode is all about what does it mean when you become certified in medical coding? What are you capable of? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a comment. I'm going to read the comment and we're going to get into it. So here we go. All right, so the viewer says, "Hi Blue, I'm about to take my CPC exam as a medical coder with no experience. At what level will I be at? I mean, coding op reports or just simple stuff at first?" Okay, so here's the thing. When you pass your medical coding certification exam, whether you have sat and passed for the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC, any one of these all say the same thing, that you have the capability and the capacity and the competence to code any specialty that is out there, as far as like ortho, neuro, psych, any of those. You have the capacity to do all of those. Why? Because you are tested on each one of those specialties. Now there is no, oh, I want to start with the easy stuff, or do I start with simple stuff? Now there are people who will be actively out there looking for entry-level medical coding positions. When you do that, you will be looking for a long time, because there's a lot of people that are looking to start in those easy type positions. You are capable of coding for anything: op reports, clinic visits, ER visits. This certification says that you have that competence. Now, don't let the fact that you have no experience cloud your judgment. Everybody started with no experience, and they learned. They learned by doing, and that's really where you're going to be at as a brand new medical coder who has no experience. I had no experience. My first job was at the Cancer Therapy Research Center. So you want to talk about being thrown into the deep end of the pool? You know, neoplasm coding is not the easiest. And when you have gone through a program where you were teaching yourself, which is essentially what I was doing, and which essentially a lot of people do, that was where I was. Did I give up? No. Did I try to look for the easy things? No. Was it nice to get easy stuff to code? Of course. But this just means that at the time I had to dig deep and I had to figure it out. And that's exactly what you have to do, is figure it out. And for those of you who say, well, no, I don't want to do op reports, well, then don't apply for a same-day surgery coder position. Just apply for a clinic coder position. Now, if you apply for clinic coding, you're going to have to know about evaluation and management. And that scares a lot of people. And they're scared often because somebody else scared them. Somebody else said, oh, this about evaluation and management, we didn't learn this, and we didn't learn that. I've done a show a couple weeks ago now, or it may have been last week. No, it was a couple weeks ago, where I talked about resources to learn evaluation and management, some programs that I recommended, and some books that I recommended to be able to learn evaluation and management. But it's going to take you as the student to be in it. You can't just sit there and say, well, I didn't learn. Okay, well, then you can learn, because there are books, there are tutors out there, there are programs, there are boot camps. The one that I recommend is the one with HC Pro. Now, they are fantastic. I've done 2 of their boot camps. They do have a boot camp on evaluation and management. It is a little pricey, but if you're interested in it, I have left that video link. I will leave the video link again for the E&M video that I did, where I talked about that. And then if you say, well, Blue, I don't have all this money to spend on a boot camp, but I want to learn on my own. You know, there's that book from Optum that I recommend. That book from Optum that I just ordered myself is fantastic. And if you work through that whole thing, you will have a better understanding of evaluation and management. Evaluation management is not hard, guys. All it is just knowing what your the table of risk means. What does it mean? When you get a really good grasp understanding of that, and then you look at the CPT book and you read those descriptions of the evaluation and management levels that tell you what it all requires in order to meet those certain levels. Once you understand all that, it's not going to be a big deal for you at all, because then you'll be able to look at those notes and figure that stuff out. But that stuff comes with time. You know, when you apply for these jobs as a brand new medical coder with no experience, they are going to know. The people that are hiring you, they know that you have no experience. But you had to have shown something, either potential or skill, in order for them to say, okay, we're going to take a chance on you. And if they take a chance on you, then you have to seize that chance. And you have to show them that they made the right choice in hiring you. They hired you because, you are able to be, you're not coming in with bad habits like veteran coders can. Veteran coders can have experience, but they can develop very bad habits depending on where they're coming from. So that's not always a good thing. It's not always a good thing to hire people who have experience because, again, sometimes they're set in their ways and they only want to do things a certain way. And that's not the way that this field is. You have to be willing to try new things. You have to be willing to get in there, get in the weeds, and feel like you're in the weeds a lot of times, because there's going to be times when, again, you're going to struggle. But you don't have to struggle when you know where to find resources, when you know where to find help. And as I've said, as I've gone on and on and on in previous episodes, if you find yourself lost, confused, and not feeling very sure, you need to work with your workbooks. And a lot of times I tell people this, and they still ask me the same thing. Well, what workbooks? The workbooks that I recommend are in the description box below. But they don't have to be those particular books. They're just what I recommend because I have every faith in those books. Those books have helped me to learn even more. But if you had workbooks from your program that you just didn't really get into, or you only did certain parts of the chapter, you didn't do everything, I implore you to go back through and work through those workbooks so that you can get the practice, so that you can get the experience, because that's where you're going to gain that confidence. When I see comments like this where somebody says, well, I don't have any experience, and I mean, again, everybody knows, and anybody who's studied this, they're either going to come in having experience in medical but not in coding, right? Or they're going to have no experience at all. I came in with no experience at all. And it's just a matter of really taking the time to stop and study and learn. And guys, studying doesn't have to be that hard. It does not have to be that arduous. All you have to do is take the time to do it. And if you invest 30 minutes or 1 hour at a time, because that's all you need, because that's as far as your adult brain is going to go. And sometimes people will tell me, well, Blue, I don't have a long attention span. Then you need to work on lengthening your attention span. Stay off of TikTok or any of those little quick little video type things, because your brain gets tricked into wanting that hit of really quick information. It doesn't want to have that buildup. You have to have that buildup in order for your brain to work appropriately. This is why y'all will not catch me on TikTok. I will never go on TikTok. I've been asked several times to do it. No, I will not do it. Because to me, I'm not going to contribute to the society that is just making the attention span shorter and shorter and shorter, and people, it's just, getting them to think only a certain way. You can't do that. You have to have a beginning, a middle, and an end. That's why all my videos, you see them, they're as long as they are, because that's just the way that it is, guys, on my channel. I take this stuff seriously, and I understand how when you take the time to study, you will get better with practice. You will get better with, okay, my attention span is lengthening. That's what this field takes, guys. It takes people who are taking it seriously, learning medical terminology, learning anatomy, learning about pathophysiology, practicing in those workbooks. That's what this takes, so that you can be more confident, that even though you have no experience, that you can code for anything. Now, there are certain tasks that, of course, you're going to have to wait on. You need experience. CDI, or clinical documentation integrity, is one of them. There are some people who say, well, Blue, I want to be a CDI. Okay, do you have any experience in medical coding? No, I'm just starting out. Okay, you need to wait 3 to 5 years. You need to get experience coding in the clinic, coding surgeries, coding ER, coding every single specialty under the sun, and every single type of patient setting, as far as like outpatient and inpatient or professional fee. You need to be able to know all of those things to be a really sharp CDI. Now, it's not a requirement in the industry to have all of that experience to become a CDI, but it sure does help, because I'll tell y'all what, yes, there's a lot of these positions that require you to be like an RN or, LPN, LVN, or any of those things. And it requires that because of that clinical knowledge. But if you don't have any coding experience, that's what's going to make it 10 times harder, because you're not going to understand why the coders need certain things, or why the provider has to be able to document like all the details, so that these levels, these appropriate levels and these appropriate procedure codes can be selected, okay? Instead of just defaulting to the default procedure, like if it's a skin procedure or something. So that's the reason that CDIs really do have to have a strong grasp of medical coding. Although it is not a industry requirement, it doesn't mean that you should just do it just because you can. Understanding why and understanding what you should know is really a big part of it to be successful. I mean, that's just my advice anyway. But as I said, once you get your certification, you should technically be ready for anything. You should technically be ready for outpatient or professional fee if you have an outpatient credential. As far as like the CCSP or the CPC, those are the two that are the most into outpatient coding. Now, the CCS and the CCA also cover outpatient coding, but they also cover inpatient coding. Now, sometimes people with the CCA or the CCS code for outpatient because they weren't really strong in inpatient coding, and that's okay too. But if you want that opportunity to be able to go anywhere, you want to be able to understand both sides, okay? That's just going to make you more well-rounded. It's going to make you more in demand, because of the simple fact that when it comes to knowing that inpatient side, again, you can code for the inpatient side if you wanted to, you could be able to apply for those positions. But again, don't let your lack of experience scare you. There are going to be some places where they will want to train you in their certain way. And there's going to be some where they're going to tell you this is not a training ground. If you are hired and you have your credential, we expect you to know how to code E&M. We expect you to know how to code diagnosis coding. We expect you to know how to do procedure coding. We expect you to know how to do modifier application. And if you don't, then you need to study. When I first got here to my forever home, that was the first thing I heard. I was part of a batch of new coders that came in roughly around the same time. And I remember hearing my supervisor saying, this is not a training ground. When you are certified, you can code for anything. And people would ask her, well, what if I don't have experience in coding in that? She says, then you need to practice. And that's just common sense. To me, that's common sense. Is if you don't feel confident in something, you need to practice with it. There's just no getting around it. And again, if you are stuck and you don't really understand, the book is not making any sense, and when you try to reverse teach yourself, it doesn't make sense even more, then that's when you have to say, okay, well, I'm just going to hire a tutor or find a mentor. A mentor will help you for free. A tutor you have to pay for. So I'm a tutor myself. My rate and contact information is in the description box below. There's a ton of tutors on LinkedIn too. So you can even put in there, hey, I'm looking for a mentor, okay? And there's people who will volunteer to help you. I've seen it many, many times when people have asked on LinkedIn for help, and they say, I need somebody to help explain this to me because I don't understand. There's a lot of people out there that are willing to help, but you have to be proactive in seeking that help. No one is going to know that you don't understand something unless you say something, right? And when you do get hired, like I said, when you do get hired and you get your foot in the door, don't be that person that's constantly running back and forth, wanting people to help you, but you're not trying to help yourself. Because veteran coders will notice that. There are some veteran coders who will say, I didn't have anybody to teach me, so I'm not teaching this person. I'm not teaching the new person. And then there will be others that will want to help, that will want to answer your questions. But you also have to show that, hey, I'm trying to learn this. Not just like, this is a really hard one and I can't figure this out. How did you try to figure it out, first of all? What methods and what steps did you use? Did you go to Google? Did you go to the CPT book? Did you go to, coding clinic, CPT assistant, any of those things? Did you use those things first before you went and tried to contact a coder? This is why I say it's very good if you're a brand new medical coder to work in a facility first, because y'all that think that this is so easy that you can do this at home because they're telling you that you can do this at home and oh yeah, it's going to be so easy. You wait. Just wait till you get out in the real world and you try to do that. And then let's just say that you do get hired at home. Because I'm not saying that it's impossible to get hired at home. There's plenty of people that still do it. However, sometimes those positions are just risk adjustment, and risk adjustment is just diagnosis coding. And if you look in some of these job listings like I have, they will say that if your only experience has been in risk adjustment coding, again, only diagnosis coding, that does not count as experience. So I have said to make sure that you keep your time with something like that very short, because that's just to get your foot in the door someplace, and so that you can get exposure to the electronic medical record, so you can start understanding what it means. You can start there, but don't stay there. People who get stuck there for 4 years and then they're trying to get out and say that I can't get out because all I've done is risk adjustment. Okay, well, you should have been working through CPT or ICD-10 PCS and keeping your skills up, and a lot of you don't. Okay, I'm just being honest with you, and don't get mad because I'm being honest. Do not get mad because I'm being honest, because we're all adults here. And this is about an industry that requires a lot of knowledge. And a lot of times when people come into this industry and they don't get that, and they're just thinking, oh, it's the money, the money, the money. If you do this for the money, you're going to be miserable the whole time you're doing it, because you're doing it for the wrong reason. The money is there. Let's not get it twisted. The money is there. However, it takes a lot of effort on your part, because again, we have to know what doctors know while never having gone to medical school. I've said that. That's my saying. I've said that since the inception of my channel. I've always said that because it's true. We have to be able to read this advanced documentation and figure this stuff out. Are you going to get it right 100% of the time? No, no one does. Why? Because we're humans. Not even AI can get it right, right? Not even AI gets it right. So I'm just saying that the more you practice your critical thinking skills, the more that you practice with these books, the more confident that you're going to be, so that regardless of you being a brand new medical coder, it's not going to matter. You are going to be skilled enough to be able to start. Because I'll tell y'all what, auditors are not always correct. There's times with veteran auditors will miss something, or they will be incorrect in their rebuttal of an error or something like that. They'll say, oh no, it's this. And in actuality, it's something else. And maybe you bring to them a coding clinic or a CPT assistant that says the opposite of what they're trying to say, and you're actually the correct one. So that's something to keep in mind. It is a very fluid field, but you have to be able to bring your receipts, bring your reasoning, bring your proof. And that's what we're about, is bringing our proof. But again, don't be fearful when you're out there. Be fearless. Be fearless when you are applying for these jobs. I tell my people, roar. Because, you can't be no meek mouse trying to get into this field either. You have to be very proactive. When you are putting your resume out there, you have to show all the skills, everything that you learned from the school. Even if you have no experience, you have skills. Okay? No experience is not the same as not having skills. People who have skills that they have learned from a program can put those skills on there. You know how many resumes I've seen on LinkedIn, and how many resumes, as a resume writer, how many resumes come to me where folks are not listing all the things that they learned, ICD-10-CM, ICD-10 PCS, that they learned that, CPT, HCPCS. They're not listing those things. Those things are important, because when you look at the job listings for medical coders, that's what they're asking for. Specifically, ICD-10-CM, CPT, HCPCS, ICD-10 PCS. Those are the things that they're asking for. If you are taking those lazy shortcuts, ICD-10, I would immediately reject it. I would not look at your cover letter. I would not look at the rest of your resume. The second you tell me that you learned ICD-10, you're out. I need to know, because there's two versions, ICD-10-CM and ICD-10-PCS. I say this all the time, and I still find it on LinkedIn. They still put ICD-10. Oh, well, they should know. No, don't ever assume that the employers know. Okay? Don't ever assume that. Now, I know I'm straying away a little bit from the topic at hand, but it all ties in together, right? You want to make sure that you are being very specific in your pursuit, and make your pursuit deliberate when you're out there looking for a job. And don't harp on the fact that you don't have experience, because they know. They're going to see that on the resume that you don't have experience. You don't even have to mention that. All you need to do is tell them what your skills are. That's what they need to know from you. What did you learn? Any jobs that you've had, you need to be able to show those transferable skills. And you need to be flexible enough that if coding is not a place that is easier to start in your area, because sometimes some areas are kind of weird when it comes to that. So if you want to start off in billing, start off in billing. It's not forever. It is just to get you in. And you are still using your skills as a newly trained coder in a billing position. And not only that, you're going to be able to make connections that way. So that might be a little bit easier. And you won't have to be thrown into the deep end of the pool trying to code all these things and not really understand what's going on. But if you start off in billing, you'll be able to see, okay, this was the documentation, these were the codes that they selected, and okay, I can see how this could happen. And then you see if the insurance pays. Now, doesn't always guarantee that those codes are correct. So make sure that you pay attention to that part. But then when you see denials, then you can see, and you can kind of go correlate with the documentation that they have. Oh, okay, well, that's why they denied it. So that's going to set you up better for success when you apply for a coding position, correct? So there's those things, guys. I've talked about that several times on my channel. Alternative jobs for brand new medical coders. You know, if you don't want to start off in coding, if you don't feel strong enough, it is totally fine. But do something that is going to get you to use your skills still. Risk adjustment. Again, only diagnosis coding, but you'll still use your skills. Medical billing. Prior authorizations is another one. Prior authorizations. You're not using your coding skill. I mean, you're not applying codes, but you are using your skill in a way, because you have to look at the documentation, call the insurance company, and find out if they'll pay for a particular procedure. And if not, you got to go back and talk to the doctor about it. So again, it's still using your skill, and you're still able to move ahead, right? Once you've spent your time there, and once you've gotten that experience, because that's also getting you experience in the electronic medical record, which is another thing a lot of you are worried about. Everybody has their own electronic medical record that they will train you on the job. Don't worry about that, but do not rely on your employer to train you about coding, because they won't. And you will find yourself without a job very quickly. Okay, I'm just saying, okay? Not to scare you, but to prepare you. And also to encourage you to work back through those workbooks. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But best of luck to you guys out there. And remember, again, everybody started off brand new. Everybody started off with no experience. You will get experience when you are being proactive, when you're out there, when you have a really great resume that is making it past all of those obstacles of, you know, right and wrong on that resume. Okay, so again, look through my videos and watch those for tips. Okay, if you're interested, you can reach out to me for a rewrite. You can find anybody who does it also on LinkedIn. Okay, so with that said, I'm gonna wrap this one up. Thank you guys so much for joining me. Best of luck to you. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.